Smalltalk has developed a recipe for success through the way we assess a child and implement therapy. The very first session you will have with us will be an initial consultation. In this 45-minute session, we talk to parents or caregivers present about their concerns and goals for their child. We ask a range of questions to help us form an understanding of your child's developmental history and the way they communicate. We then spend some time one-on-one with your child assessing their communication skills, and we look at different aspects of communication such as how they understand language, how they express themselves, how they socialise with others, and how easy they are to understand. The information we gain from this and from the discussion with parents allows us to determine which assessment would be most appropriate to provide the information required to formulate goals and implement therapy. In the last 10 minutes of the initial session, we summarise our observations and recommend an appropriate assessment, providing details about what the assessment involves, what information we will get from that assessment, and how it will help formulate goals and a therapy plan. We offer a range of assessments at Smalltalk to ensure children receive the appropriate assessment for their needs. We have a speech assessment, which looks at the child's intelligibility and includes an oromotor section, which looks at the child's motor abilities and strength required to produce speech sounds. We also have language assessments, which look at the child's understanding of language and how they express language. They look at a range of different areas and provide us with information about the child's strengths and weakness. They also give us an age equivalent of where the child is currently functioning at. We have a social language assessment, which looks at a child's social skills and how they socialise with others. We have a pretend play assessment, which looks at the different stages of play. And last but not least, we have a functional communication assessment, which looks at the child's suitability for AAC or alternative augmentative communication. For example, this would be used when the family wants to set up a visual communication system for the child. Families will receive a report of the child's strengths and weaknesses no matter what assessment is conducted. This will also contain recommendations and a therapy plan. The observations and discussions from the initial consultation, as well as the assessment data, all pulled together to formulate a therapy plan. We feel it's really important that this plan reflects the goals of the child and their family and what their needs are. Each therapy plan is different for each individual and is tailored to suit the client's strengths and difficulties. Up on screen now is an example of an individual therapy plan or an ITP for a client which is provided in the first therapy session. As you can see, goals are separated into different areas of communication to ensure all difficulties the child may have are addressed. Goals are also separated into short and long-term goals. We colour code goals so that we can keep track of all the goals that are being targeted or those that are being achieved. Yellow are goals that have been achieved, green are goals that are currently being worked towards, and pink are goals that need generalisation or maintenance in the child's environment. From the therapy plan, we choose 4 to 5 goals to work on each session. These form a weekly individual therapy plan. We plan activities based on these goals and also provide home therapy handouts, strategies and activities for practice at home to help achieve the goals. Activities are enjoyable for your child but also beneficial in achieving the set goal or goals. Having set goals also allows us to measure your child's progress. After each session, we document the child's progress from the session and also list home practice suggestions. This is provided to parents after each session to allow them to keep track of the goals, but also to keep track of the child's progress and what was achieved during the session. As you can see, the example above is the example of an individual therapy program that is handed out on a weekly basis. So there are the long and the short-term goals stated there. In blue is how the child performed during the session. So in this example, the child had difficulty with the letter sequence MNOP. Also in blue are some home practice suggestions for people to work on at home. Finally, therapy is about achieving goals, but also about having fun and creating an enjoyable learning environment for each and every child. If you are interested in learning more or would like to get in contact with Small Talk Speech Therapy, please feel free to like us on Facebook or join our mail subscription available on our website at www.smalltalkspeechtherapy.com.au.